Welcome to the NHSN diff training, What, When, and How to Report. My name is John. I'll be your operator for today's call. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session. Please note the conference is being recorded. And now I'll turn the call over to Teresa Mandela.
Thank you, John. Good afternoon, everyone, and welcome to today's webinar. As John said, this is NHSN diff training, What, When, and How to Report. Next slide, please. Well, wait, what? This is a VHQC diff initiative webinar, right? Guess what? VHQC is now Health Quality Innovators, or HQI. We decided to change our name to reflect our broader reach, our exceptional team, and commitment to improving healthcare. Folks used to ask us, what does VHQC mean? The letters that made up the old name didn't explain who we are and what we do. We are health quality innovators, making a measurable difference in individual and community health. Now we have a name that underscores that mission. In addition to being the quality improvement organization in Maryland and Virginia, HQI now improves healthcare for people in a total of 7 states plus the District of Columbia. But nothing else has changed, and no other changes are planned at this time. There is no ownership change. We are still the same nonprofit organization selected by CMS to be your Quality Innovation Network, Quality Improvement Organization, or QIN/QIO. We keep adding seasoned team members as we grow, and Health Quality Innovators now employs 70 individuals with expertise in quality improvement in every setting of care. There is a new website, too, www.hqi.solutions, and our email addresses now end in hqi.solutions. We welcome you to check out hqi.solutions on the Internet. Next slide, please. I'm Teresa Mandela, the Improvement Consultant with HQI, and with me today are Linda Harris, Improvement Consultant, Sheila McLean, the Program Director, and Sandy Nappick, our NHSN Coordinator. Today's session will be recorded, and you will be emailed instructions on how to access this recording from our online community. Let's face it, the entire process of registering to use the National Healthcare Safety Network, or NHSN, and then enrolling your facility and finally doing the reporting is a little bit complicated. So do keep in mind that you'll have access to this webinar in the future from the online community. During our presentation, if you would like to share any thoughts or questions, please use the chat box located to the right of the screen. At the end of the presentation, we will open the phone lines for questions and answers. At the conclusion of the webinar, we will also post evaluation questions. Next slide, please. Oh, goody. Today we are joined by 2 guest speakers from Health Quality Innovators. Several of you on the call know our infection prevention nurse extraordinaire, Deb Smith, from Virginia. Deb is a fantastic resource who has done very detailed work with hospitals in their healthcare-associated infection journey, including NHSN reporting. And also standing by is Katie Richards, who hails from Maryland, where she works at the Maryland Department of Health and Mental Hygiene in the Healthcare-Associated Infection Program. She was the HAI Program Coordinator Epidemiologist. We are delighted to have Katie Richards now as a full-time improvement consultant with HQI. Deb, Sandy, and Katie will be leading us through the steps of reporting in the NHSN using the screenshots you will see on your computer when you log in and are ready to start reporting. Next slide, please. Some of you may already work closely with us at VHQC, now called HQI, but others may not know what a quality improvement organization is. Just rest assured that our expertise includes knowledge of long-term care, infection prevention, population health management, and building community-based coalitions to reduce readmissions. Next slide, please. Just as a reminder also, HQI is funded by the Centers for Medicare and Medicaid Services, or CMS. We provide education and support at no cost to nursing homes in Virginia and Maryland through the National Quality Improvement Organization, or QIO program. Remember, for every initiative, you have access to guidance from HQI's long-term care team and faculty experts. We're pleased to offer you education, practices, QAPI tools, and a data-driven approach to support your facility. Next slide, please. All right, let's dig into today's webinar. Think back. The participation agreement for the C.DIF initiative that the infection prevention team leader in your building will actively participate has been uploaded to CMS. Let me repeat that. The participation agreement attesting that you on the phone, the infection prevention team leader in your building, will actively participate in this initiative has been uploaded to CMS. This means your facility has committed to register, enroll, and report into the CDC's NHSN system. Every week, Medicare sends us a list of which facilities have enrolled and which have not. You don't want to be on the have not enrolled list for Medicare. So where are you in the NHSN registration and enrollment process? If you haven't started, we'll be sending out U.S. Marshals to your facility in about 25 minutes. Now, I'm only kidding. It'll take them a couple of hours, actually, to get there. Next question. Have you gone to your notary and had the forms verified and scanned them over to the CDC? If you scanned and notarized your forms and sent them to the CDC more than 3 weeks ago, and you still haven't received your SAMS grid card, you need to contact Sandy Napick immediately at sandy.napick@hqi.solutions. And I'm going to spell that. It's sandy.knapick@hqi.solutions. Have you already received your SAMS grid card and you did the happy baby dance and that you posted on the YouTube? No? Well, it's coming perhaps. Did you submit your contact and survey form to get enrolled? Did you sign the forms and get the final notice of successful enrollment? Did you join the required groups in the NHSN system and map your facility? Did you add new users? Next slide. So why in the world are we emailing you, calling you, and hounding you to complete this process? Well, that's because there is a deadline, and it's been set by Medicare, and we want your facility to be on the successful nursing home list tracked by CMS. The deadline for getting all this done is October 31st. Halloween is scary enough without you missing an imposed NHSN deadline. Now, I want to say a shout-out because there's some attendees on this webinar who signed up today who are already through the enrollment phase, and we'd like to quickly recognize them. Let me give a big congratulations to Levendale, South River Health and Rehab, Stella Maris, Lay Hill Center, Anchorage Healthcare Center, Autumn Care of Suffolk, and Nova Health and Rehab. And many, many of you, over 70 buildings, are otherwise in the process, either have received or are waiting to receive your SAMS grid card. So you'll be able to move to the next section very shortly. Next slide, please. Because we love puppies and kittens and your facility, we want you to be very successful in this process. So there's another new resource, and frankly, it's the best one yet. We didn't give it an original name, but I will tell you the new step-by-step NHSN enrollment, setup, and data guide was emailed to all of you during the first 10 days of October. Sandy Napick sent you an email with this new guide as an attachment. I would say open it, use it, and save it to your desktop. This is not the binder that we sent you. This is not an email booklet that we sent you. This is the guide, not the TV guide, the NHSN new guide that came from Sandy Napick, and at that time her email address was sandy.napick@vhqc.org. So please contact Sandy right away if you have not received this. And now, Deb Smith and Sandy Navik, along with Katie Richards, will lead you through the next portion of today's webinar. Next slide, please. Oh, we're there.
Thank you, Teresa, and good afternoon, everybody. I'm really happy to be here. I've been working behind the scenes, and this is the first time that I actually get to talk to all of you. I am in the HQI, formerly VHQC office today with Sandy, and we have Katie on the line in Maryland to jump in with her expertise. So we'll just get started. These are our objectives for today. Reviewing your reporting checklist, looking at your long-term care C.diff data collection forms and protocols that you have available. The big one, reporting NHSN into NHSN, your CDI Lab ID data. Understanding some of the data documentation, and we'll have just a couple of samples as we go through. So why are we even doing this? Why are we tracking these infections in long-term care? We've been doing it for many, many, many years in acute care. We want to be able to comply with infection surveillance regulations and identify most common or harmful infections that are impacting your residents and staff at your facilities. We also need a baseline in NHSN to begin looking at that data and being able to trend and track your data towards an aggregate. We'll use that data also to drive prevention activities in your facility and across the nation, because you know, with that data, we can't show improvement. So, once again, why do we have to use NHSN? And this has been a question that's been asked by many over the years. However, I will tell you that I have come to have a love-hate relationship with NHSN. There is so much data in there that's so useful to pull out. But it is a big system, and sometimes you just have to work with it. It's the most widely used infection tracking system, and there's not just for infection tracking, but there's all types of surveillance tools that are available to you. It's going to establish benchmarking. You're going to have great reports that you can print out and share with your leadership. It's accessible and available across a number of different care settings, and it gives you the ability to share data. Using NHSN can demonstrate improvements or areas of opportunity. It raises awareness and motivates change. So we listen to your request. We're going to go over each step of reporting this time. We've had previous webinars that have gotten you to this point. You all have this info, so you're more than ready. You have a helpful guide that was emailed to you that really makes it easy. You've also got all of these slides in your binder or Bible that you got earlier in this program. So I'm going to go on to the next slide here. Once you have, we're going to assume that you've got your SAMS card and you're all ready to go. You have that grid card, and you've logged into the secure portal and selected NHSN reporting. So that's where you come back to this slide, and that's where this NHSN reporting is. So you'll select NHSN reporting.
Deb, can I jump in for 1 second?
You can, because there we go. I couldn't get my page to go. Yes.
So when I first joined NHSN, I kept forgetting where to go to get to the SAMS login page. And just a reminder, if you just go to www.cdc.gov/NHSN, or even just Google NHSN, the first result is the NHSN homepage, and from there you can click to get to the NHSN login screen.
Thank you, Katie, for reminding us of that. Yes. So once you're on that landing page, hello? I'm sorry, I thought I heard someone. Once you're on that landing page and you've clicked submit, you'll be ready to go. So you're let's just back up a little bit. You've already mapped your locations in NHSN, and you should have already reviewed and entered your monthly reporting plan and updated it as was needed. Now we're going to go into actually identifying and entering CDIF Lab ID events. And if you have any questions about mapping locations or entering your monthly reporting plan, that was covered on the last webinar. That webinar was September 21st, and that's available on the online community. So this is where you would verify your locations. So you would go to that wonderful little blue side, left-hand side of your NHSN website, and in there, everything that you have to do is on that menu. You can click, if you don't know where some things are, sometimes it may not seem so intuitive, but trust me, it's all there. So you would go to Facility, click on Facility, and then click on Locations. Now this is going to pull up, after you click Find, this will pull up all of the locations that you have previously mapped. After you have mapped and verified your locations the first time, you won't have to do this all the time. You may only have to do this yearly when you're making sure when you fill out your annual survey that everything is still the same, or if you know that during the year you do change a unit acuity. Sometimes you might pull this up if you have new staff and you want to show the new staff, but typically this won't be a normal part of your monthly routine. So you should always check to make sure that you have a reporting plan in place for the current month that you're reporting in. If you don't have a reporting plan in place, you would need to add one. So you would go to the Reporting Plan tab at the side, blue side, click Add, and you would add your reporting plan. Now you're doing just the Lab ID module, so that is the one that you could add. But we do have on here just an example where there's also an HAI module if you so chose to track UTIs in your facility. Also, I want to remind you that once you've created one accurate reporting plan, you can go ahead and copy that plan over for each month, and you can actually go to the end of the year with that. That way you don't have to remember to do the reporting plan each month. And this is just a reminder that all identified CDI Lab ID events have to be entered into NHSN. But first they have to be an identified CDI Lab ID event. So let's talk about what that is. This is not lab events from outside your facility. You don't track them. Anything before the resident was admitted should not be included in your event reporting, including specimens collected while the resident was in your care. Some of the advantages of this type of Lab ID event reporting is that it is a metrics-based reporting plan that allows you to report without following any clinical evaluation to the resident. So all you're doing really, and it does sound like it's a lot more than what it is, but we're just reporting each of these events. We're not going in to do any kind of surveillance to see whether it is healthcare onset or community onset. There's standardized case definitions within NHSN, and NHSN calculates that for us, as long as we're reporting correctly. So, what is a CDI Positive Lab Assay? This is a positive laboratory test that is positive for C. diff toxin A or B, and it includes the molecular assays like PCR and toxin assays. Or it can be a pathogen-producing C. diff organism that was detected by a stool culture. And please remember that we are only testing liquid stool samples, and that's a stool sample that conforms to the shape of the container. So for NHSN reporting, the definition of a positive CDI Lab ID event is a C. difficile positive laboratory assay that was obtained while a resident is receiving care at your facility, and that resident has had no prior C. diff positive laboratory assay collected in the previous 14 days while receiving care in your facility. So this is really important for you to understand. We do not report duplicate Lab ID events. And a duplicate Lab ID event is any C. difficile positive laboratory test from the same resident following a previous C. diff positive test within the past 2 weeks while that resident was in the facility. We do not report the duplicate test to NHSN. This is a nice little algorithm that you should probably keep close by when you are reporting your CDI Lab ID events. So it just is telling you here that if you have a positive test result and you've had a prior in less than 2 weeks, and if you do not have a prior less than 2 weeks, you report it as a CDI Lab ID event. If you do have a prior that was greater than 2 weeks, you would report that as a CDI Lab ID event. So I also want to talk about the importance of keeping a line listing, because honestly I don't know how we would follow this if we didn't have a line listing of all of the positive Lab ID events for each patient in your facility. So let's just take a look at this particular example here. This patient has a new event, a positive C. diff lab assay on 1/3. For whatever reason, another test was ordered on 1/9. And as you can see, that's less than 14 days from the first test that was ordered. So this would not be a Lab ID event. The first event, the new event, would have been entered into NHSN. This second event on 1/9 will not be entered into NHSN. Then on 1/20, which is still less than 14 days since the most recent, which was on 1/9. So you do not go back to the original event on 1/3 to count these 14 days. You just go back to the last previous positive. So this event on 1/20 will not be reported into NHSN. Yes, it is a positive C. diff lab assay. No, it is not a Lab ID event that is reported in NHSN. On 1/29, which is still less than 14 days from the 1/20, they do another test. They are really testing this patient quite often for C. diff. This also will not be reported into NHSN. But I want to show you something here. So this positive lab on 1/20 would have been 17 days since the first event. So if you would have erroneously reported that into NHSN, NHSN would have accepted that event, and it would have been another new event. So you have to be really careful and count these days, because NHSN is making the assumption that when you do enter a new Lab ID event in NHSN, you are entering an event that does not have a previous positive within the last 14 days. Now, this patient, they went on in the next month, on February 23rd, they retested this patient again, and since that was greater than 14 days from the last positive, that is going to be a new CDI Lab ID event. So when you do start reporting your CDI Lab ID events, please keep this in mind. Please make yourself a line listing somehow, however you want to do it. And if you have any questions, reach out to us because we're happy to go over this. So now you know which CDI events you're going to be reporting. Behind tab 10 in your binder that you've received, there's a number of NHSN forms and instructions. And this is one that is a form for filling out the Lab ID CDI event for long-term care. This actually very much mirrors the way that you're going to enter the information into NHSN. So if you do fill this out, you'll be prepared when you log into NHSN to do your data entry. So on the top is the resident information, and then the event information is down below. This is just another important tool in your toolbox. Okay, so now you've got all of your Lab ID events are documented, and you know which ones you're going to call. You've gotten rid of all your duplicates. You know which ones are new events and need to be entered into NHSN. So now we're going to start entering data. Once again, you go over here to the blue side of NHSN. You pick event, because this is an event that you're going to add. And you click Add. This, of course, is going to come up. This screen, it will not have everything entered into here. This is where you'll start entering. All the red asterisks are where you need to enter data. So you'll enter your facility ID, so whatever alphanumeric identifier that you assign to each resident in your facility. This is the ID that stays with the resident across all visits and admissions. This is what you put into here. You also come over and enter the resident's Social Security number. You enter the resident ID. Oh, I'm sorry, up here is the facility ID. This is the resident ID, where you would be entering that specific number for the resident. This is your facility ID. You also need to enter gender, so you would come down to enter the gender. You would put the patient's date of birth down there. And then you come down here to the resident type. So when you click on the resident type, you'll get a drop-down box and you pick either short stay or long stay. So a short stay is a resident who stayed in the facility for up to 100 days from the first date of admission to the facility. A long stay is a resident who stayed longer than 100 days. So you pick short or long there. The next thing you're going to be entering is the date of first admission to the facility. This is the date that the resident first entered the facility. So if the resident leaves for a short period of time, and that's defined as less than 30 consecutive days, and then returns, this date doesn't change. This stays the date of admission. Then you come over to the date of the current admission to the facility. The date of the current admission to the facility is the most recent date the resident entered the facility. So if the resident entered the facility for the first time and didn't leave at all, this date of first admission and date of current admission will be the same. I'm sorry, I'm having trouble with my clicker. There. The next thing you're going to be picking then is the event. So what are we doing? So when you drop down this box, you'll be picking Lab ID identified MVRO event. And when you pick that event, you also have to come over and put the date that the specimen was collected. So you would find that on your lab sheet. That's not the date that it was reported. That's the date that it was collected. Then you have to come down and pick the specific organism type. So you will always be picking C. diff or C. difficile. Once you pick C. difficile, the body site and the specimen source are pre-populated because that's the only type of specimen that's used in NHSN for C. diff testing. Then you have to pick your resident location. And that would just be whatever unit your resident is on. And then you come back down to here, what is the primary resident service type. So you do have choices like hospital or palliative care, dementia unit, long-term general nursing type. You pick the most appropriate choice there for what type of care your resident is receiving at the time. You need to know whether or not the resident's been transferred from an acute care facility in the past 4 weeks. If it's yes, then you need to click on these following fields. When you click yes, these 2 fields will open up. So then you need to be able to put in the date of the last transfer from an acute care facility to your facility. So you enter the date of that transfer. And you also will be entering yes or no for whether or not the resident was on antibiotic therapy for this specific organism type at the time of transfer to your facility. So you're going to have to know that if they're on antibiotics, it was specifically for C. diff. There's a blank down here that you just leave blank. You don't have to fill this out because that's for NHSN internal use only. So I'm going to stop and just make sure. Katie, do you have anything to add?
I don't want to complicate it too much, but I do know some people may be concerned about specimens that are tested on the day of admission to the facility or the next day from admission to the facility, which obviously are community-associated events. And I wanted to just let them know that NHSN, when you do the analyses, will distinguish between a community onset and a long-term care onset for your specimens. And it will further categorize if there is a recent hospitalization entered. There is another ACT low classification for acute care transfer, long-term care onset. So the system will do those categorizations when it comes time to analyze your data. So you don't need to worry about, well, they just got to my facility. Do I still need to report? Yes, you do. And it's in the later analysis that it will distinguish between community and long-term care onset.
Yes, that's really good to remember. Thanks for mentioning that. And that's why it's so important to get the date of admission correct on the page before, because that's what NHSN is going from. They're going from the date of first admission. Okay, we put this in here. This is a screenshot of something that you might see. Just know that when you do add an event and you put the patient identifier, the resident identifier in that space, if the resident is in the system, so if you reported another lab ID event for that resident in NHSN, it'll pre-populate that field of anything that you put in before. But if the resident has not been put in, you'll get this message here that says it could not find the resident, and you need to directly enter the new resident in. Just don't be concerned. You click OK, and it will open up all of the screen for you to be able to enter. Also, just wanted to put this up here where there's a validation or error. NHSN will not allow you to enter a CDI Lab Assay event within 14 days of each other. So if you do try to put one in that was less than 14 days since the previous, you'll get all the way to the bottom here and hit save, and this box will pop up and tell you that it is an error. But just remember, you have to follow your line listing, because if there was a previous positive lab ID event in between, it would have taken this one then. All right. The next thing we have to do is to collect our denominator data, or our number of residents, number of admissions, and number of admissions on CDIF. So this is another tool that's in your toolbox in the work that's been sent to you from Sandy. She's gotten all this out to you. So this is actually in your toolbox. You can use this form, or you can make one up of your own. But just know that you need to collect this data daily. You're only going to be reporting monthly totals into NHSN. But the easiest way to get accurate monthly totals is to collect this data daily. All right, now you've collected that data, and it's time to add your denominator data or your summary data to NHSN. And this is extremely easy to do too. You just go into the summary data and you pick add. Now, if you try to add and it doesn't pull this up, it could be because you don't have a monthly summary data entered into NHSN. So you can also click find. If you click find and you put in your month and it's not there, you just have to go back and enter that summary data so that you can report, because it won't let you, NHSN will not let you report anything if you don't have your monthly or your monthly plan in place. So once you click add, this screen is going to come up. Now I do want to tell everybody that you don't have to be concerned about the denominators for long-term care. This particular part will not be on your summary data sheet because you weren't picking the UTI when you did your annual plan or your monthly plan. So what is going to come up is this part where you're going to add your facility ID. That'll be already populated because that's already in there. You'll come down, you'll select the month. So if we were doing this month, we would drop down this box and select October 2016. And then we'd come down and we'd put in the total from our daily collection sheet of the resident admissions. For each day of the month, you'd count and record the number of residents admitted to the facility. Now this includes both new admissions and readmissions. Then you also need to put the number of resident days. This is the number of patients reported for each day of the month. And then you need to have a total of the number of admissions that were on C-diff treatment. So when you documented that a patient was admitted to your facility with C-diff treatment, those days are also counted. That would be the sum of the number of patients each day that are admitted to the facility, and also each day that a resident is receiving antibiotic therapy for C. diff infection. So it's all new admissions and readmissions. Note that if your facility doesn't have any lab ID events for the month, so if you have no positive C. diff to report, you do have to mark the report no events box. If you don't mark the report no events box, you will not get data out of NHSN.
Deb, it's Teresa, and I want to say thank you for bringing that up again, because none of us in long-term care are used to using the NHSN, and it would seem to us normally that, oh good, it's another month, I'm so happy we didn't have any C. diff in the building, I don't have to put anything in. Not only do we need to go in and put this information in, but we need to make sure that we are getting credit from the NHSN for being a facility that month that did not have any positive C. diff events going on. And that from a long-term care perspective, it's extremely important when we do not have events that we do get counted as not having them. So thanks for bringing that up.
Yes, and I forgot to put my little red dot there, which is now off the box where you're going to be, hopefully every month, just putting a little check mark there and report no events. Now, even if you don't have any events, though, you do still have to put your denominator data in. So you still have to put the resident admissions, resident days, and numbers. Well, of course, there's a number of days on C. diff treatment, yes, because you could have days on C. diff treatment without a positive lab ID event. And actually,
the cursor here so people can see the numerator.
Which is the, see, there, you see how this is right here, report no events, it's this bottom line right here, is where you'd be putting that. So now we're going to talk about some action items and alerts. And actually one of the alerts would probably be if you put denominator data in and you didn't have any lab ID events and you did not mark no events, that's going to be an alert that will come up for you. So whenever you first sign on to NHSN, you'll be immediately notified if there's any action items or alerts. So if there's anything that you have to take care of right away. And that can look like this. So if there are any alerts that show up right away, like you shouldn't have any alerts the first time you sign in unless you haven't completed your annual survey. But you will have already completed your enrollment process and your annual survey. So the first time that you sign in to actually report any CDI Lab ID events, there will be nothing on this page. But as you go on through the months and you're reporting, this is where you go to make sure that you aren't missing any events, that you don't have anything incomplete, that there's no summary data missing, or that your summary data is incomplete. So if you do have one of these events show up, you would just click on the type of event that you have. So this is incomplete summary data for this particular event that's showing up. So when you click on incomplete summary data, it'll bring you down here, and the data that's incomplete, there's a hyperlink that you would click on there, and this particular one would take you directly to the page for your July 2015 summary data that's incomplete. And this one was incomplete because there was no box checked to indicate no CDI events were identified for the month. So NHSN is looking out for you. They want to make sure that you get all your data in the way you should be getting it in and on time. So all you need to do in this case to resolve this alert is to put that check mark in the box. That's an easy one. So our alerts must be resolved before any kind of reporting can occur. You will not get reports out of NHSN if you have any of these alerts. So if lab ID events have already been reported during the month for C. diff and the report no events box will be disabled, that will prevent you from checking it erroneously. If a lab ID event for C. diff is identified and entered in NHSN after checking no events, so if you have to go back and enter one later after you've already checked no events, that report no events box will automatically uncheck. So don't worry about checking it too early. All right, I am going to turn this program back over to Teresa. Please let me know. My contact information is on there. Get in touch with Sandy. She can get in touch with us. We really want you to be successful with this NHSN reporting. And I understand that a lot of you won't be reporting for a while. So this is just kind of an overview right now. We can definitely get more specific and help you one-on-one when the time comes. All right. I just want to make sure, Katie, do you have anything else that I missed?
No, I think you've got it.
All right. Teresa, the floor is back to you.
Thank you. Thank you so much, Deb and Katie. And I know Sandy was there in the background as well. And we really appreciate you walking us through the steps because it is new to all of us. And because we live in the nursing home world where you can't get everything done in one sitting, my friends, there is homework. The things on this screen, though, we're calling them homework, but you've known about all of them in advance. So let's review. If you've not already submitted the contact form and the long-term care annual facility survey form to the CDC via email, you have homework. Now remember that long-term care annual facility survey form, that's NHSN speak for a questionnaire about your building. It really has nothing to do with an inspection survey. It's a facility survey form. We're here just answering questions about the facility, where the residents reside, what kind of care you offer there, the type of C. diff labs that your particular laboratory performs. The next thing is if you haven't received the NHSN follow-up email, printed the forms for you and your administrator to sign, and sent them in by mail to the CDC, you have homework. If you haven't set up your facility and mapped it yet and put together a monthly reporting plan that Deb talked about, that's also known as an MRP, remember the cool part is you can copy it over and over, so you only have to create it one time for the whole year. But if you haven't done that yet, you get some homework. And if you've done all the above steps, but you have not yet added another user because we want you to be able to go on a vacation, have babies, whatever, and not worry about this, you do need to add other people. So, yep, you have homework too. And even for you wonderkins out there who've done everything I just described on the last slide, there's still a little bit of homework to do. As Deb mentioned, you're going to need to know how to determine and how to track resident days, resident admissions, and resident admissions on C. diff treatments because you're filling out the NHSN denominators for long-term care facilities form and then entering that into the system. The first two of those, the resident days and the resident admissions, should be easily obtained. If none of you are aware of, or some of you are unaware of how to get that particular information, the first step would be your administrator, second person would be your business office, third person would be your admissions coordinator. And for some of you on the call, using certain electronic medical records, that information can be pulled on a daily basis out of your EMR system. Start now familiarizing yourself with the NHSN Lab ID Event Form that's in your binder. It's also online if you go to the CDC and then the NHSN web link. Because there is going to come a time, just as Deb was describing, where you have a resident who has C. diff and they have a positive lab, but you need to figure out whether that specific lab is actually going to be counted as a positive lab ID event or not. And we will be having a webinar again in the future where we're going to go over more of those kind of quiz scenarios where is it or isn't it, and it is important for you to understand that. This also, we mentioned this on that last homework slide, but it bears repeating. Set up the monthly reporting plans for your facility, have them ready in advance, and then that's going to save you a lot of time each month. You don't need to go it, and let's hit the next slide. You don't need to go it alone to get up and running with this initiative.
All right, it appears that we have lost Teresa. So I think what she was going to tell you is that we're a team. HQI is a team with you. You have your team in your nursing homes. Please don't hesitate to reach out to one of the team members. There's Sandy's and Teresa's and Linda's access information where you can contact them and ask as many questions as you want. Remember, the only stupid question there is the one that you don't ask. So please just ask us. Don't worry about reaching out to us. So I see that we do have a couple questions in the chat. So we'll try to address some of those questions. Are the lines open or closed right now?
Well, the phone lines are closed. Did you want them to hit star 1 if they have a question?
Yes, please. So if anybody has a question that they'd like to ask, you can hit star 1. John will put you in the queue. We do have a question.
One.
Hello?
Yes, this is Katie.
It looks like we have a question from Kimberly Wilson. Where will the patient's age come from for C. diff, or is it the same number for all infections? Oh, that's Kimberly, I'm not quite sure what you're asking, but let me take a stab at this unless you can unmute yourself. But this would just be specific days of treatment for patients with C. diff. It's not the same number for all infections. You would not be counting all infections or all patients on antibiotics. It would be patients with C. diff treatment. Does that answer your question?
Tell her she can type in the chat if it is.
Yes, please let us know in chat if it does. And then from Brian, is there a date when the prior month will close and we won't be able to enter data into NHSN? Brian, as somebody who has been monitoring NHSN for projects, I wish that was true, but it absolutely is not. NHSN is never locked to you. Now, what does happen is there's dates when, like CMS or other public reporting agencies, pull data. So there are dates where you need to have your data validated and entered, and that particular improvement agency will pull the data and use it for their data. But you can continue to go back and change data in NHSN. It's one of those things that, for me, I feel like there should be a lockdown date, but there isn't. You are expected with HQI and the project that you're in to report no longer than 30 days out from the end of the previous month. So that would be at the end of July, your July data needs to be in no later than the last day of August. So I hope that answers your question.
And also, build on that, it is very important to have real-time data. You can use NHSN in real time, and so it's good to enter in your events as soon as you can and not wait.
Absolutely. John, do we have any questions in the queue?
At this time, I have no questions.
Hi all, it's Teresa. I'm back. Sorry, there was a big boom, and then the phone went dead as a landline.
Welcome back. I'll turn it back over to you, Teresa.
Oh, you guys are so great. Thank you. It's sort of like you're watching Breaking Bad, and there's a boom, and the phone line goes dead, and you wonder what should have happened. But in any event, I think we are at the end, and so I can see in the chat that there have been questions. Anything that you're sending in at the last minute, we certainly will pick up and chat again. We encourage you, as always, to reach out to Sandy Napick with your questions. Don't be shy. And we wanted to thank everybody that was participating in today's webinar, and we thank you for your attendance, for your attention to all of this NHSN CDIF reporting process, and please enjoy the rest of your day.
Thank you, ladies and gentlemen. That concludes